So I decided to pull my sister, Ellen, in for a little video today because her and I were talking, and she is a nurse and I am a therapist, and we found that we do a lot of similar sort of coping and self-care strategies with our clients or patients, and we do them ourselves. So I wanted to sort of get her perspective, one, because her field is different than mine but related, and her personality is a little bit different than mine, so it's just a different perspective. So I just want you to talk, and I didn't let her prepare for this, so this is just her walking in from work. So I just want to hear sort of, one, kind of your thoughts on self-care in general, how you sort of work with your clients with it, and sort of what you kind of recommend and how you help them, and then also just kind of your kind of strategies for yourself.
Okay.
So wherever you want to start, you're good.
Okay, well, self-care is huge in my field because usually the reason why I'm in there taking care of someone, I do home health and hospice. So the reason why I'm in there taking care of someone is because they haven't done any self-care
For a long time.
Yeah, and it's just caught up with them. I normally work with the older population, and they haven't been taking their medications, they haven't exercised, they haven't ate well, they haven't stayed hydrated, they don't go see their doctor. And so it just, when I come in, the biggest things I stress right off the bat are the basics, just doing, exercising and doing your daily routine and doing nutrition. For example, today I was talking to my patient. I just discharged her from home health, and she, I said before I left, I said, most important thing you can ever do is to create a routine. So you wake up in the morning, eat breakfast, do your workout, and then, then take your medications, and then take a drink. And she has heart failure, so she needs to break, but biggest thing is lack of routine. And once you get a routine down, you do a lot better. But so that's the biggest thing. Do you want me to go into more detail?
No, I think that's great because it's interesting because so she works with a totally different population than me and a totally kind of different field, but that's exactly the same as what I do with my clients, right? And what I do with myself. So a routine is huge, and no matter what your age or your situation, whether you have a huge health problem or you don't, you're just trying to kind of get something going or get motivation, whatever it is, routine is huge, right? And we are creatures of habit, so the more we maintain really good kind of routines, the better life gets and the easier life gets. And it also takes less motivation for us to do those things. So it's hard to fight each day to get up and do things. But if it's a habit, we just find ourselves getting up, doing our little workout, doing our little routine, and it's easier. So if you're struggling with health issues or mental health issues, that can help a lot because it takes the fight out of it. You don't have to fight as much with yourself and with your routine because you just know this is my structure, this is my schedule, and it makes it a lot easier. I also liked what you said about back to the basics because that is also universal. We all need to get back to the basics, especially if you have something that comes up that sort of throws you off. I had a client this week who had a panic attack, and she was just really off. She got a migraine after that, so she was off emotionally. Sorry, we're shooting at home, so those are the dogs. And he doesn't do well with attention, so. Anyway, so my client, she was just really off this week, and that, I'm gonna go check on them. And I'm just gonna keep going, because this is what happens in life, right? This is what happens all the time. So, anyway, coming back around. So, we went back to basics. And that's literally what we called it, too, is we're just going to get back to basics. She was super off emotionally, super off physically. She was feeling bad because she was off her routine and she wasn't getting things done. But we just reset back to basics. Just purely taking care of herself. So she's got to eat, she's got to hydrate, she's got to sleep, she just has to rest. So she was just taking a few days to basically just reset, do nothing, get back to the basics, refocus, and just kind of reset. So that's kind of what I was doing this week too with her, and that's what some of us need to do all the time. We just need to refocus, take care of ourselves, and just give ourselves sort of the time to do that. Welcome back, Ellen.
Thanks. Dogs are taken care of, so we're good.
Good.
But yeah, I actually had a thought when you were talking. That maybe I don't have a thought.
What was your thought?
Well, I think I'm obviously new at this, so I think it's super important because I also deal with mental health issues and physical issues. A lot of the ways I've learned how to, sort of help my patients, not as good as Diana, but it comes from Diana. Is one of the biggest things is like people with depression. I deal with depression a ton, especially in hospice, because people do not know how to handle that grief because they're not only, the whole family's grieving already because the patient has got this terminal diagnosis, as well as, the patient is grieving as well. And so, depression is one of those things where routine helps a ton with these patients, because if they can wake up and accomplish one thing, they feel good. They've accomplished one thing, so they can go on and do the rest of the stuff. So creating a routine and self-care matters a ton. Like, I remember one of my patients when she was just having a hard time and was just not really doing anything, and we called it a spa day, and we did shower and got everything cleaned up and everything, and she would look at herself in the mirror, and I'd never seen her do this, but she would look and fix her hair and smile and really enjoy what she saw, which is such a big deal, especially for her because her depression had been so bad. So self-care really changes your attitude, I feel like, on how you feel about yourself and how you can approach your day.
Yeah,
I think
it's big. It's big, especially if you haven't been doing those things, right? And when you're depressed and when you're really down, you're really struggling, even simple things like showering can be hard, or getting ready can be hard, or doing the little things that can be hard. So taking a spa day, I love that you called it that, because sort of we're going to take care of ourselves today. We're going to clean the house, we're going to shower, we're going to do our nails, we're going to just get ready and really kind of flip that, which a lot of therapy is sort of reframing. So that's a kind of a reframe. We're not going to call it do what you need to do, shower day and clean day. We're going to call it spa day because that's more fun and we can get more excited about that. So it's all about sort of reframing, being yes, this is good. This is a positive thing. We're going to do this.
It's going to be fun.
It's going to be good.
Yeah.
So I really like that. The other thought I had while you were saying that was, you said you're new at this. One, you're new at this as far as video.
Yes.
But you're not new in this field, and you're not new to self-care.
No.
And you're also really good at this. So I also want to point out that you put yourself down a little in saying you're not maybe as good at this, or that, whatever. But you are. You're really good at this. She's really good at patient care. Really good at. I'm not lying though. Really good at
good to me.
Really good at building people up, building their strengths. I think reaffirming people, being really positive. Those are things you sort of do naturally, which is why she's so good at nursing. But I think that's a really big thing too. Is just being positive and affirming and kind, not only to your patients but to yourself, right? Working, doing that yourself. So for that lead in, because it's a lot easier for us to be kind to other people, right? And we can preach this all day, it's really easy to give the people we love patience and care and understanding, and like tell them you should, take care of yourself. You deserve a break. Like you need to be nicer to yourself. But it's harder to do that for ourselves. Always. Like this is always the case.
And you already caught me in it. So.
I did. And just slightly, but I'm just going to go there because I wanted to go there anyway. But so it's easier for you and for me to take care of other people sometimes than it is to take care of ourselves.
Yeah.
So how do you take care of yourself? What does self-care look like for you? And how do you know that you need it?
I think I know. I'll start with that last question.
Okay.
Because I usually don't recognize that I haven't been doing self-care until it's like overwhelming. Like all of a sudden I'm super stressed out. Everything's chaotic. And I have to take like a day where sometimes, which is probably not the best coping strategy, I binge watch some Netflix and I just lay in bed for a little while. And then I'm like, okay, I just had time to just relax. And then it's like I have to kick my butt in gear and, do those normal things that I preach all the time, the basics of, eating good, exercising, staying hydrated. So I think like for me, what makes me feel more centered, more happy, just able to do the things I need to do is, exercising's big for me, eating well's big for me, hydration's big for me, so the basics.
Yeah.
And then also, religion plays a big part in my life, so keeping that into my daily routine helps me. And then I get a lot of happiness from building relationships, so I like to be with my family, with my friends. I spend extra time with patients so that I kind of get that relationship feel. And so I just think, how nice would it be that if I were to just do that every day, I wouldn't have to spend the day binge watching Netflix. And then by the time I'm done, it's always like, oh shoot, I've got so much to catch up on now because I've just been too focused on one area of my life. So,
but that's a really good example of sort of what happens. And it's okay, it's normal, it's life, right? So she's really busy, she works a lot, and she gives a lot to other people. So I think when you get really overwhelmed, it's like you've given so much that you're like, okay, I don't have anything left. I need to step back and I need to reset for a second. And at that point, it's important to recognize that. And then it's also important to give yourself that time to do that and to be okay with it.
Yeah.
Right? Like I had the same conversation with the client that I mentioned earlier this week who had the panic attack. She's like, I asked her what she needed, and she's like, you know what, I really just feel like I need to like watch some crappy TV, curl up in like a really cozy blanket, and just like sit there for a while. And I'm like, well, what's stopping you from doing that?
Yeah.
And it's this. What's stopping her was that voice that's like, you shouldn't be doing that, or that's not productive, or that's not okay.
Yeah.
Kind of like you said, it's not the best coping strategy. But guess what? Sometimes it is. Sometimes you need to be alone.
Well,
sometimes you need to
nice.
curl up. Sometimes you just need to distract.
Yeah,
right?
I like that you just told me I can do that. I am going to feel real good about this. Best thing about Diana is she doesn't make me feel bad about things that I think I should feel bad about.
Well, you shouldn't, right? So sometimes we need to watch crappy TV and just chill. And that's okay sometimes.
Yeah.
And I really do think that's okay sometimes. So it shouldn't be our only strategy, right? Your only coping strategy should not be watching Netflix.
Come on.
But
Why not?
sometimes you need that. And like you said, if you get really overwhelmed, you need to reset and then go back into the things you need to do.
Yeah.
Because if you just go right back in there, you didn't have any decompressing time, you didn't have any downtime, you didn't have any alone time. So you need that time, and it's okay to give yourself that time. Just stay in, chill, do what you need to do, and then when you feel a little bit re-energized, then you sort of go back out into the world, and now you have energy to engage with people, to go to the gym, to do those things. But sometimes you need downtime, and that's fine. That's great, right?
Yeah.
And it also depends on your personality. So she's a little bit more extroverted than I am. So my downtime my like Netflix sleep time is probably even more than hers is. Because if I'm extending myself a lot, then I like to reset more with quiet time and downtime and alone time. So I don't even think you do that as much as I do, you know, but you still need to reset.
Yeah.
And then she recognizes, hey, like I get energy and I feel happy from relationships. So I'm going to put more energy into my social life and into, you know, the relationships that I care about. I'm going to get active because that makes me feel better. I'm going to make sure I'm eating right. I'm going to make sure that I'm drinking enough water. I'm going to do all these things. And when I slip up, I'm not going to make myself feel bad about it. Or I added that last part. All the rest was true. But I added the last part, right?
I mean, it's true.
Okay. So yeah, I think that's really great. And it's all something we all can do, I think. And just relax a little bit and give ourselves a little bit permission to kind of just give ourselves what we need. Which reminds me, one more thought I want to share is I was talking to another client this week who's a mom, a single mom of 2 young kids, and she kind of gets a little bit defensive when people are talking about self-care because she said, I'm trying my hardest and sometimes I just don't have time to take care of myself, and sometimes I have to do these other things. And in talking to her, we sort of reaffirmed that she was doing everything she could. And sometimes when you have other obligations, like you have kids, that's going to come first, right? You have to take care of your children. You have a job. You have to take care of your patients, right? And that's okay. You can do that. And you shouldn't feel bad about taking care of the things that you need to and the people that you need to. And then when you have time, do what you need to do for yourself. And it doesn't have to be big. So her thing was like, you know what? I really like tea, and I like to make tea and just have even a second while the kids are napping to just drink my tea and enjoy that, and that's my self-care. And guess what? That's enough right now for her. That's enough. That's what she has time for, and that's great. So it doesn't have to be big things, and it shouldn't be adding to your list for you to feel bad that you're not doing. It's not supposed to be like, oh no, I didn't do these things, I feel even worse. That's not the point, right?
Yeah.
The point is to make you feel better. So find small ways to make yourself feel better, and if you don't meet those goals, it's okay. It's not something to feel bad about. It's something to just make you feel better, so try again the next day. That's all you can do, right?
Right. Well, I like that.
Any thoughts?
Good job.
Anything you'd like to add?
You pretty much nailed it, girl. Proud of you. Awesome.
See, she is also who I call when I'm like, I need some affirmations. Please build me up. This is where I'm struggling. Tell me I'm okay.
Yep.
So, well,
good.
thank you.
Yes.
Thank you for letting me pull you in and put you on the spot. Appreciate your input.
Thank you. Thank you, guys.